community-based health care and ambulatory care, that is the future. With Lutheran, that's also its roots.
I'm coming out of a situation in the last school. There was no school-based health center. Like, I hadn't even heard of it until I got here.
The teachers are totally committed to this, so they provide time for the children to go down, get their health care, get their dental care, and return immediately back to the classroom.
So, Toni, your sugar is a little high today. What do you have for lunch?
In Toni's case, her diabetes wasn't well controlled at all. So she was having a lot of high sugars when she was testing.
We had to coordinate her care while she was in school with the teachers, the staff, the lunch staff.
Just knowing that NYU Lutheran is here, she feels a lot more comfortable about the fact that her child is in a very safe environment with a lot of support.
I feel loved because they're taking care of me, and like, let's say something goes wrong with my blood sugar or I don't feel good, they'll call my mom.
Without this joint venture between the school-based programs, NYU Langone and NYU Lutheran, I think patients just like Toni would fall through the cracks.
Many of these children and families live in very difficult economic and social conditions. And it really seems to me to be a model, not just for New York City, but for other big urban centers.
The best way to have healthy children and healthy families is to consolidate care as much as possible within the community so that the scarcity of time and resource on the part of these families can really be not erode their commitment to their children's health.
I think Carla and Nino recognized when they first came to Lutheran is that it is a fabulous place for primary care. That's what we do. They understand the connection with improving the quality of care for kids in our community.
To have people like Carla and Nino committed the way they are gives you every chance to be better every day you wake up.
They're passionate about NYU Langone, they're passionate about Brooklyn, they're passionate about patient care. They are emotionally and passionately connected, and that makes an enormous difference.
Medicine is changing to where it's important to manage the health of populations. And family medicine is at the heart and the core of managing populations in an effective, high-quality way. Claudia Lyon is one of the first in the graduating class of our family medicine program.
When I came to Lutheran, now NYU Lutheran, and was exposed to the family medicine faculty and the department and the residents, I really was inspired and knew that family medicine was the right place for me.
She comes to the patient's bedside with a passion for making sure that she treats patients right and making sure that her students and her residents treat patients right. And you can't fake that.
Thank God for people like Dr. Lyon, because they're the troops. They're where the battle is engaged, right there. They're there with the patient.
Now that we're NYU Lutheran, it's certainly the most important and exciting change I've seen happen in my 28 years here.
Lutheran was a little gem in Brooklyn. We thought that we could take all the good things that were going on there and add some of the things that we do well and make it into a truly great institution in Brooklyn.
People see the ferry as an immediate connection to our partner.
And it's truly facilitated the connectivity between these two institutions. And it also said, when we say we're going to do something, we do it.
And our vision was to be the go-to hospital or the hospital of choice in Southwest Brooklyn. I think the way we see ourselves now is becoming the hospital of choice in Brooklyn.
This is our time. This is the opportunity for us to really, live out what Sister Fetty had in mind when she started this hospital.
We love them. It's bigger than the scope of their practice. It's what they offer from their heart that is extremely priceless and you can never replace.